All right, we're here today with Michael, and Michael's about to start his treatment with Dr. Davis. Now, Michael, both of your knees are affected, correct?
Yes, both my knees are affected.
And one is worse than the other?
Correct, my right knee.
The right knee's worse than the other. And your discomfort level today in those knees is a?
It's like 5 to 6.
5 to 6, okay. So, how long have you had the knee problem?
Knee problems probably like 3-4 years.
Okay. Have you seen any other doctors for this?
No, I have not.
So this is your first attempt to get it corrected and
Yes.
get rid of the pain. Okay. So what I'm going to do is I'm going to have you stand up for me.
Okay. Stand up.
Yep. Now, was there any discomfort doing that?
It's low on my outside right here.
Right there on the outside? Okay. Now, if you could do a squat for me. Arms out in front of you. Yep. How low can you go?
Oh, jeez. That's not there.
And that was probably a 10. And where did you feel that pain?
The back of it.
In the back of both knees?
Both knees and
Okay. All right. Yeah, that's not good. All right. Now I'm going to have you go up and down the stairs for me.
yeah.
All right. And back up the stairs. So out of all the exercises, I'm going to have to say that squat was the most painful for you, correct? Okay. And I know this is also affecting your work too, because you're getting down on your knees and you're having to measure things and stuff like that. So
Yes.
we need you to get back on track. All right, let's get you started. You ready?
Yes.
All right. All right, we're back with Michael, and Michael has finished his first treatment with Dr. Davis for his knee problem. So, Michael, I'm going to have you stand up for me. And how was that?
Feeling great.
All right. The next thing I'm going to have you do, Michael, is I'm going to have you do a squat for me. So, arms out in front. How low can you go? Holy smokes, that was much better. Much better. All right, so now the next thing I'm going to have you do is I'm going to have you go up and down the stairs for me. I want you to hold on to that railing. Yep, hold on to that railing and go up and down the stairs. And try not to get wet. All right, so what have you noticed?
It's a lot looser. My knees don't hurt as much.
Your pain level was a 5 in those knees. What do you think it is now?
Just like 1 or 2.
A 1 or a 2?
Not bad at all.
Definitely. And your squat seemed like it improved.
Improved a lot.
That's probably the most is the squat, right? All right, so we need to get started on therapy.